Good evening, everyone. So my next topic, which I'm going to discuss with you, is on introduction to pharmacology with important terminologies. Means what is the introduction to pharmacology with important terminologies? And before I start my video, I want to request you if this video is useful to you and if it is helpful to you, kindly subscribe to my YouTube channel. This is Dr. Nitika Pharmacology Discussion. Now I'm going to discuss with you introduction to pharmacology with important terminologies. The pharmacology has been derived from the Greek word pharmakon, which means drugs, and logos means times. And drug is the substance which is used for the prevention, diagnosis, treatment, and cure in man and animals. Now, it can be used prevention like BCG vaccine. It can be used for the treatment of tuberculosis, smallpox vaccine for the treatment of smallpox, for the prevention of smallpox, and we use contraceptives for the prevention of pregnancy. Diagnosis like for various colonoscopy, rectoscopy, we use barium meal study. In that, barium sulfate as the radiological agent is used. Treatment like antiemetics were used for vomiting, antigesins for cough, paracetamol for pain and fever we use. Cure for the cure of tuberculosis, we give anti-tuberculous drugs. For the cure of malaria, we give anti-malarials, and for the cure of cancer, we give anti-cancers. And WHO definition of the drug is a drug can be defined as a substance or product that is used or intended to be used. It is used and it is intended to be used to modify or to explore the physiological systems or pathological states. Means it explores the physiological systems or pathological states for the benefit of the recipient. Nomenclature of drugs, this can be divided into chemical name, non-proprietary generic name, and proprietary brand or trade name. Chemical name is according to chemical structure like acetyl salicylic acid. Non-proprietary or a generic name is a name given by the competent scientific body like United States adopted name or British adopted name, or which appears in the official publication. The official name, which is aspirin, and proprietary brand name is which is given by the manufacturer or property or trademark, which is the Disprin. Subdivisions of the pharmacology can be pharmacy, toxicology, posology, chemotherapy, pharmaco or therapeutics, materia medica. Now, pharmacies, which is the science which deals with the pharmacy, that is for the preparation and standardization of drugs, like we prepare iodine, weak iodine solution, we prepare KMNO4, Mendel's paint, we prepare ORS salt solution. Toxicology is for the just the science of poisons and poisonings. Like we know about the toxic effects, undesirable effects of the drugs, the mechanism of action of the poisonous substance on living system, and its treatment. Posology means study of various dosage forms like oral dosage form, enteral, parenteral, inhalational dosage forms. Chemotherapy means is a substance used for the treatment of the chemotherapeutic for the infectious diseases. This is also known as chemotherapeutic agents. They do not have any harmful effect on the host cell, but they kill the invading organisms. Pharmacotherapeutics is the practical application of knowledge of pharmacology in prevention, treatment, or diagnosis of the disease. Like it can be rational therapeutics, it can be empirical therapeutics, or it can be accessory therapeutics. Now, when we use the rational therapeutics, it is the mode of treatment is based on the pharmacological action of drugs correlated with the pathological aspect of the disease. Means what is the pharmacological action of the drug correlated with the pathological aspect of the disease, like use of digoxin, which is the sodium potassium ATPase pump inhibitor. So it can be used in the treatment of the congestive heart failure in the myocytes. Empirical treatment is which is based on the experience. It is the mode of treatment which is based on experience, and it is not any on the pharmacological explanation. Accessory means in addition to the drugs, but all accessory treatment we can give, like we can give the vitamins and minerals in malnutrition, addition of suitable food. Materia medica means which deals with sources, what is the source of the drug, what is the description and preparation of the drug. And it has been replaced by the term experimental pharmacology and clinical pharmacology now. So materia medica, it has been in Indian materia medica include knowledge of plants. It is the Ayurveda, the traditional medicine. It is based on the treatment, hygiene, and balance in the body's stage of being. So we know the knowledge of the plants. We grow them in seasons. There is method for storage and shelf life of the harvested materials, and how we obtain the juice from vegetables, dried powders from herbs, and cool infusions and extracts. This is the materia medica. Experimental pharmacology means which how we perform the experiments on the animals. So these can be used further in the for the human use. Clinical pharmacology is these it is divided into pharmacokinetics and pharmacodynamics, and which is the therapeutic evaluation of the drug in human subjects. Pharmacokinetics consists of ADME, that is absorption, distribution, metabolism, and excretion, which is what the body does to the drug. And pharmacodynamics is the to know the biological effects of the drugs, the site at which it is acting, what is the mechanism of action of the drugs, and the relationship of the plasma concentration of drug with the response and duration of treatment. And this is what the drug does to the body. Immunopharmacology means it is the science which deals with the drug action, immunological aspects of the drug action, including effect of drugs on immune system, means whether they are immunomodulators, immunostimulant, or immunosuppressants, and whether they are producing the antibodies in response to drugs, means drugs are given, whether there is production of antibodies in response to them, is that whether they are immunostimulants or immunosuppressants, means that is immunopharmacology. Chronopharmacology means the investigation of drug effects as a function of biological timings. Is what is the effect of the drug as a function of biological timing, as well as the effect upon the rhythm characteristics. Like bronchoconstriction can be there in the noon and afternoon because of the peak acetylcholine levels to induce bronchial action. So there can be alternation in the plasma glucose and growth hormone circadian rhythm by insulin. Pharmacogeneticness, what is the genetic makeup of the individual? The difference in the inherited genetic makeup of individual will lead to difference in the drug metabolism and response in humans. Like there can be prolonged action of succinylcholine in persons with less of pseudocholinesterase. Means those are having less of pseudocholinesterase in them. So succinylcholine will not be metabolized in them, and that can lead to respiratory paralysis. Pharmacoepidemiology means is the study for the use and effect of the drugs in large population after its approval for clinical use. Means they have been approved for the clinically, and now we study their effects in the large population. Means there are certain adverse effects comes in the patients, like thalidomide disaster. So to study those adverse effects and various other studies to do them, we use them in large population. Pharmacovigilance is the to know the unwanted and other safety specs related to marketed drugs, unwanted side effects which come. We have to detect them. We have to assess those unwanted side effects. We have to understand and prevent those effects. And this is the science of knowing those unwanted adverse events or adverse effects. That is pharmacovigilance. Thank you. That's all for my terminologies and introduction to pharmacology. I hope you understood my video. And if you like my video and if it is helpful to you, kindly subscribe to my YouTube channel. This is Dr. Nitika Pharmacology Discussion. Thank you. Be happy, be healthy, be wealthy, be blessed. Happy learning. Thank you.